Okay, this is the third part of the tutorial session for dental student of King Faisal University. As you can see here, I don't know why all these flags. We can identify them. Just wait. Is it clear enough now? Clear enough? As you can see here, this is the sphenoidal air sinus. Sphenoidal air sinuses. Okay, we have no time. Sphenoidal air sinuses, and this is the frontal air sinuses. As you can see here, this is the palatine tonsils. And from the genio we have the genioglossus, and this is the geniohyoid. I'm going too fast because we've been through this for the last exam. This is the genioglossus, geniohyoid, and just below the geniohyoid we have the mylohyoid. Okay, no need for the flags. Okay, just focus with me. This is the auditory opening or opening of pharyngotympanic tube. Auditory opening or opening of pharyngotympanic tube. And this is, as you can see here, the soft palate. Let me flip it. And here is the epiglottis, leaf shape, epiglottis. Now, here's the story. Here is the story. As you can see, this is the larynx, so this would be the laryngeal nerve, which supply the larynx. It's not difficult to identify since it supplies the larynx and it's coming from the top, so it's the laryngeal nerve. You might find some confusion with this. Hope not. Just wait a second. As you can see here, this is the right side, so we have the right brachiocephalic, and from the right brachiocephalic we have the subclavian and the external coronary artery. Correct or not? Correct. So this is the right brachiocephalic. How could you differentiate between the subclavian and the external coronary artery? Look, external coronary artery would give branches, while the subclavian not at this level. See? This is the external coronary artery and this is a branch of it, while the subclavian have no branches. Has no branches, okay? So this is the right brachiocephalic, and this is the external coronary artery. Since there is a branch coming from here, there's a branch, and the other should be the subclavian since no branch can be seen. So we've mentioned that, we've mentioned this one, the laryngeal, external cord, and the epiglottis. Finish with this. Okay. Could you modify the zoom or focus anything? When you are ready, tell me. Okay? Is it clear now? Shall I pick it up? Okay. This is the maxillary artery. As you can see, maxillary artery. Look, below the maxillary artery, which runs superficial to the pterygoid muscles, this is the pterygoid muscle. As you can see, we have the lateral and middle. How can I differentiate between the middle and lateral pterygoid muscle? It's as simple as I'm going to tell you. Could you see at this muscle? This is the lateral pterygoid. It's ascending toward the mastoid process. See the direction of the fibers. If it's ascending toward the mastoid, so it's the lateral pterygoid. And if the fibers descending toward the mandible, it's the middle pterygoid. It's that easy. Don't make it complicated. This is the maxillary artery. Below it we have the lateral and medial pterygoid muscles. Fibers toward the mastoid would be the lateral, and the fibers toward the mandible would be the medial pterygoid muscle. Finish with this. This is real nice cadaver, we can see. As I told you earlier, this is the parotid gland, and this is the parotid duct, and for sure this is supposed to be the, I won't tell you, they will answer. We've told them in the first part. This is the, what's wrong? I'll hold it for a minute, then come. Go and wash your face. I'm not gonna do it on my own. Yeah. Okay, I'll be quick. This is the parotid duct, this is the parotid gland, Bender, could you hold it for a minute? Could you hold it for a minute? Hold it.
Yes,
Oops. Dry your hands. Dry them, yeah. Hold it firmly. Don't check it, okay? I'm in the camera. I didn't mean your ass.
Okay.
Okay?
ايوه هذه.
English only. This is the parotid gland. This is the parotid duct. As you can see here is the superficial temporal artery. Is it clear enough or not?
Clear.
Clear
enough.
Sure. This is superficial temporal artery, parotid duct. Just a second. Hold it just a second. This is the parotid duct. And here, the story.
Again?
Here is the story. As you can remember, we have the superficial temporal vein and the maxillary vein will form the retromandibular. And the retromandibular at the lower border of parotid gland will divide into anterior and posterior division. The anterior division will join with the facial to form Salah, a prayer time. Okay. Anyway, this is the facial vein. This is the facial vein. Okay, doc. 2 specimen only. We have to. Okay, doc. This is the temporalis muscle. This is the temporalis muscle. This is inferior alveolar vein. Inferior alveolar vein. And this is the lingual nerve. Lingual nerve. Come here. Only one more. Okay, doc. Okay, this is the trapezius muscle. Trapezius muscle. Come here. Yeah, okay. Trapezius muscle. These muscles are arising from the sternum. So this is the sternohyoid muscle. Sternohyoid muscle. This is sternomastoid muscle. Don't repeat after me. Sternomastoid muscle. And this is the thyrohyoid muscle. Thyrohyoid muscle. Okay, doc, just 1 minute. This is the sternohyoid. Sternohyoid. As you can see here, this is the subclavian vein and this is the subclavian artery. Finish. Prayer time.
طفيها
خلصتوا صورتوا كل شيء؟